Hello, everyone. Welcome to Northwestern Cardiovascular Genetics Clinic. As a part of Northwestern Medical System, we'll do our best to provide you with the best healthcare service that's suited to your needs. Northwestern Medicine is one of the flagship hospitals, which is nationally ranked and among the most prestigious hospital systems here in Illinois. Northwestern Cardiovascular Genetics Program specializes in those who have a personal and family history of cardiovascular disorders, including cardiomyopathies, heart failures, inherited heart rhythm disorders, and more. These are what we call genetic disorders, meaning that these genes can be passed down from parent to children and can be shared between family members. Before we get any further, let me explain to you what genes are all about. And genes are the basic unit of material in our body that is pretty much makes up all the traits in our body, from our hair color, skin color, and eye color, along with all the other kinds of traits in our body. In fact, this is where you get the saying, you got your father's eyes, you got your mother's nose, or anything like that. We receive one set of genes from each of our parents, and those mix to form what essentially becomes you. However, there can be tiny little changes that happen in these genes, and it's possible that these changes can have some kind of healthcare consequences. This is where a genetic counselor will come in to discuss with you how these genetic changes affect you and if your cardiovascular disorders originate from a genetic cause. In the clinic, genetic counselors are those who focus on making sure that the patients and family members clearly understand how genetics could affect you and your family members, offer you genetic testing option, and explain how genetic test results is relevant to you. This way, you have as much information that you need for you to make an informed decision making regarding your own health. During the session, we'll be asking you some questions regarding the personal and family medical history. We'll also be discussing what kind of tests might be available to you, along with the benefits, limitations, and the risk of testing. Once you have completed the genetic testing, we will discuss with you your genetic testing result alongside with our resident cardiologist. Finally, we want to talk to you about how you're managing your cardiovascular conditions. In the Cardiovascular Genetics Clinic, our services are not limited to treating your cardiovascular conditions. As your cardiovascular conditions get managed, you may face anxiety, depression, fatigue from your genetic condition, and you may even feel overwhelmed by the fact that some cardiovascular conditions may lead to sudden death. Mental health is a vital part of managing your own health condition. And we genetic counselors specialize in providing you support and resources to give you during your most difficult times. The relationship with your genetic counselors will last even after your first appointment. We'll always be here to support you during your time of need. And furthermore, we'll also be managing education, genetic testing of your family members as well. The cardiovascular conditions do not only affect you, but can also affect other members in the family due to how genes are shared between family members. Therefore, our goal is to not only support you within the clinic, but also support family members by providing them with genetic testing and education to see if they have inherited the same genetic condition. This way, we can determine their risk for cardiovascular diseases and offer you and your family appropriate medical recommendations to manage your condition. As a part of Northwestern Medicine, we have access to numerous support groups and community. For example, Mended to Hearts is a national nonprofit organization available to Northwestern patients that has supported heart disease patients, their families, and caregivers for over 60 years. You'll be able to find other support groups through calling 877-926-4664. Thank you so much for watching this short introduction, and I look forward to seeing all of you in clinic soon. Thank you very much.